Hey, Margie here. Unfortunately, too many people suffer with arthritis, pain in their knees and joints, and this can negatively impact your bones and overall health because you're not able to do the exercise program you would. And many of the root causes of osteoporosis are also root causes of arthritis. The good news is there's a lot that can be done when we look at this through an integrative approach. And that's just what we're going to do today with our very special guest, Dr. Micah Yu. And Dr. Yu is an integrative rheumatologist who incorporates complementary medicine with traditional rheumatology. He is triple board certified in rheumatology, internal medicine, and lifestyle medicine, and certified in functional medicine. He has a very unique perspective on autoimmune disease and arthritis, as he is both a patient with arthritis and physician. And Dr. Yu joined me recently on my summit, and I got so much wonderful feedback that I asked him to come on the podcast and share these wonderful tips and strategies and approaches he has with arthritis with all of you. So this is packed with great information, so stay tuned. Welcome, Dr. Yu. I'm so happy to see you again.
Thank you, Margie, for having me on the show. I'm so excited to talk to you today.
Well, I loved meeting you and having you on the summit. And I got so many people thanking me because people don't really understand arthritis and really know what's possible. And you as an integrative physician, a rheumatologist, you come from both worlds and you merge both worlds. And you really give such a good perspective. So I'm so excited that you're going to share all this with the podcast audience as well.
Yeah, there's so much to talk about today. I'm excited to share all my knowledge with you.
Well, what I love, before we get started, because you didn't just pop into being an integrative rheumatologist, you want to share your little, maybe the cliff notes of your story so people can understand why you are so passionate about the work that you do.
Yeah, so, I'm an autoimmune arthritis patient myself. I have spondyloarthritis, but it took a long time and a long journey to find out this diagnosis. I was diagnosed with gout at a very young age of 17. And, gout's not an autoimmune arthritis, but it is very painful. And over time, my arthritis did transform where it didn't look like gout anymore. It looked like something else, something that I didn't understand. I not only had joint pains in one joint, but I started getting joint pains in multiple joints, including the TMJs, the feet, the knees, and the hands, the wrists. So every single joint throughout the periphery, you name it, I had pain there. So it was a tough time because I started getting these pains right before medical school, and I suffered throughout medical school, and I saw different rheumatologists with no answers. And finally, during residency, the attending rheumatologists were able to finally diagnose me after many, many years of being a mystery case. And they offered me medications, but I decided that I didn't want to be on medications. And I was hoping there would be another way out, hopefully with food as medicine. And luckily, I was able to find food as medicine as a therapeutic modality to heal my own problem. And I didn't need to go on these, sometimes what do you call it, toxic medications in the terms of a patient's point of view, like methotrexate, leflunomide, or the biologics. There's pros and cons of course, they help a lot of patients, but myself as a patient, I didn't want to go on those, even though I do prescribe them still. And I went on a plant-based diet, and I went to remission within 2-3 months. So it's been a really tough and long journey, but one that's been very rewarding along the way.
Wow. And so then you decided that that's what you wanted to do, help others since you were helped this way?
Exactly. Yeah. I wanted to become a rheumatologist when I started getting this joint pain, but I had no idea that the field of integrative medicine existed, what it was, what you learn in it. So after I'd finished rheumatology training, I went into lifestyle medicine. So I got my board certification there. Then I went to a 2-year fellowship at the University of Arizona with Dr. Andrew Weil and the integrative medicine fellowship. And then became board certified, and then I did functional medicine. So I know that there's not enough knowledge out there that I can conquer. There's too much knowledge, actually. So my thirst and hunger for learning all these different ways of healing patients is never ending because of my own disease. At first, I thought it would be a curse, but now it drives my passion. It's a blessing in disguise. So there's a lot of ways to heal patients, and integrative medicine, there's many layers of integrative medicine. So I'm board certified in integrative medicine, but there's a lot of, I would say, doctors or practitioners out there that call themselves integrative medicine, but don't really have the proper training. They do a little diet and they call themselves integrative medicine. But really, there's so many layers to this. You can talk about diet, you can talk about herbs, supplements, and I could talk about the way I treat patients with you. It gets very deep.
Oh, great. Well, we're going to go into all that because what I see, and it's so upsetting to me, there's a lot of things I see. I see that there's a lot of people that just believe, even at a young age, oh, my mom had arthritis. I've seen people in their 40s, their joints are aching. Oh, it's arthritis, nothing I can do. People just think as they get older, they get arthritis and that's it. And I know that's not true. So that's one thing I wanted to talk about. But the other thing that in this population of people I work with bone, issues with osteoporosis, osteopenia, what I've seen, which is so incredible, is that sometimes the root causes of osteoporosis are also the root causes of arthritis or vice versa. And there have been numerous people, for example, I've seen this so many times where, and we'll talk about this, but somebody will decide for whatever reason, not even being tested, that maybe they're going to get off gluten. And they get off gluten, and then lo and behold, their bones improve. Next time they get a DEXA test, they feel much better. There are all sorts of issues. But their arthritis has gone away. All this pain has gone away. So it's just so fascinating that food can, and different things that cause inflammation, that can be a root cause of osteoporosis or also arthritis. So anyway, well, let's get started. Before we even start, though, why don't you, because there's two different types of arthritis, and people sort of get confused the difference between osteoarthritis and rheumatoid arthritis. So you want to just explain the difference?
Yeah, so there's many different types of arthritis out there, but rheumatoid and osteoarthritis are the two of the most common ones. Rheumatoid arthritis is an autoimmune arthritis. It's also known as inflammatory arthritis, meaning there is systemic inflammation throughout the body that's driving this autoimmune disease known as rheumatoid arthritis. And osteoarthritis is more wear and tear. So you see a lot of elderly patients get osteoarthritis. Sometimes the fingers start hurting, but there's no swelling, there's not much stiffness. And people usually get at a younger age if they do professional sports, or they do their construction business, or they've been in the military. There's a lot of trauma and a lot of hard work on their joints. But if you weren't in those fields, sometimes you use your hands a lot, you knit a lot, you type a lot, and sometimes that adds wear and tear to the joints. And the age that people get osteoarthritis varies. Some people can get at a young age, and some people get at a very old age, but some people don't even get osteoarthritis at all. So it varies from patient to patient.
And in terms of rheumatoid, you want to share why there are more people, the connection between rheumatoid arthritis and osteoporosis?
Yeah, so rheumatoid arthritis patients have a higher risk of having osteoporosis because there is inflammation going on in the body. One of the first things we look at for early signs of rheumatoid arthritis on x-rays is osteopenia of the hands. So that's bone thinning of the hands, and that's one of the early signs of RA, or rheumatoid arthritis. And one component of osteoporosis is not only has to do with hormones, but it's inflammation. Inflammation can increase the osteoclast and drive down the formation of osteoblasts. So there's more bone turnover and more loss of bone because of systemic inflammation. And rheumatoid arthritis will drive that inflammation if it's unchecked.
Okay, so for someone with rheumatoid arthritis, how do you proceed with them? And the good news is, people think, oh, that's it, I have rheumatoid arthritis, but that can go into remission, correct?
Correct. Yeah. So, with traditional medicine, if a rheumatoid arthritis went to a regular rheumatologist, they'd be giving medications. It could be biologics, which are very expensive medications, like 50 grand a year, which will most likely help with the disease. And there's cheaper medications, but they're all immunosuppressants in a way. In patients that come to me, I do a lot of different things. Not only do I talk about regular medications, which I still use, but we talk about diet, sleep, stress, exercise. But not only that, there are multiple drivers of chronic illnesses. We talk about infections, we talk about trauma, we talk about tick bites, we talk about the type of, we talk about environmental toxins. What kind of water are you drinking? We also talk about mold and what kind of home environment are you in? So there's a multiple things and aspects of healthcare that I look at that most doctors don't even talk about or haven't even learned about.
And have you seen that you've been able to help people get into remission once you deal with all those factors?
Yeah, some patients, it takes a very long time. Some patients, it's as easy as changing the diet. So some patients within 30, 60 days, they're in remission. Other patients, of course, it takes longer. So it varies.
How wonderful, though, that there's an alternative. So now let's talk about the more common, the osteoarthritis, which I see all the time. And as I said, people just think, oh, I have to live with it. But regardless of what, it really impedes their workouts. It impedes their life. They have pain. And, let's start with your workup. I would love to hear your approach with your background. And I think this will be really helpful for people to hear what's possible and what things they can do.
Yes. Is your question on the workup of rheumatoid arthritis or
Now,
osteoarthritis?
rheumatoid, it sounds like that's a large workup because you have to do all the root causes. It sounds like you need to figure out what the cause of the autoimmune issue is, correct? And then you deal with that accordingly. But let's talk about osteoarthritis. So someone comes in and, they have osteoarthritis wherever, and they just, the person that's sitting out there thinking, yeah, I just have knee pain. It happens with old age, and they come to see you. So where do you start?
Yeah, so osteoarthritis, I look at, so first of all, I make sure that the patient doesn't have rheumatoid arthritis because it can be very tricky. They can be sometimes, the picture can be kind of gray. It's not always black and white. But if I determine the patient does have osteoarthritis, I look at their minerals and make sure their nutrients are intact, that they're having optimal levels of magnesium, zinc, copper. Because if you don't optimize those that can drive more inflammation. Because even though osteoarthritis is a disease and condition of wear and tear, there is still local inflammation happening at the joint. And we do know on research that there is gut dysbiosis or gut microbiome changes, even if the patient has osteoarthritis. So I always look at micronutrients. I make sure there's no underlying infections. It's very similar to rheumatoid arthritis. I always try to look for the root cause as well. I look at the gut microbiome, so I do gut microbiome testing, making sure there's no parasites, yeast overgrowth, make sure there's no gut dysbiosis happening where I can fix things. And I also ask the patient about the environment as well. If the patient has mold exposure, that can drive the acceleration of osteoarthritis. So I really look at a lot of different factors, which is similar to a rheumatoid arthritis workup as well.
So a couple of things on this. Do you do then the stool testing? Is there a specific one you like to do for the?
Yeah.
Yeah.
There's a lot of good companies out there. There is Doctor's Data, there's Genova that does the stool testing. I don't do it on every single patient because it's costed $400 for these tests. Some patients, they just need some supplements and diet changes, and that's good enough for their osteoarthritis. Other patients, I do a deeper dive. So I do the cheapest things first for the patient, and then I layer in the more expensive tests.
But what I find interesting, so let's say you find out whether you do this, they do have dysbiosis, which you want to just, for anyone listening who doesn't know what that is, you want to just define dysbiosis so they understand.
Yeah. So gut dysbiosis means, so your gut microbiome, let me paint the picture here first. Your gut microbiome has a lot of gut bacteria. There's good gut bugs and then bad gut bugs. And it can be out of balance. So a gut dysbiosis means, simply put, your gut microbiome is out of balance. And I want to check on the stool test, why is it out of balance? Or if it is out of balance, if it is it because there's yeast overgrowth or candida overgrowth? Is there a parasite in there that I'm not aware of? Or is there certain gut bacteria that you don't want to grow too much that are overwhelming your good gut bugs? So I look at all these factors in the stool, and from there, I hopefully sometimes when you treat that by changing the diet, by adding some probiotics and prebiotics, that can help with their own osteoarthritis.
That's so incredible and I see this with sometimes younger patients who've been through cancer treatment or have been through various things where they've been on long-term antibiotics and they've really destroyed the good bacteria, that all of a sudden they have, diffuse joint pain. And it's hard for them to believe that. What do you mean if I if I improve my gut microbiome, it's going to help my joints. A lot of people don't see that connection. Is that something you see on a regular basis?
Yeah, sometimes it's not every single patient because there's so many factors besides the gut. But so some patients, it is the gut microbiome affecting their pain. And once they resolve it, they do improve. But there's so many factors that affect the gut. It's not just food, it's stress, it's hormones, it's infections. There's so many drivers of it.
Okay, so continue. So we work on the gut. You do the gut test, the tools.
Yeah, we work on the gut, and then I also check for heavy metals. So I make sure the patient didn't have a high mercury or high lead levels, because if you have high levels of those, that can contribute to inflammation and also the destruction of the joint over time as well. So I make sure the heavy metals are normal there. And then I look at mold as well, because mold can cause a lot of problems. Mold can cause brain fog. It can also contribute to joint pain as well. So make sure the patient doesn't have high levels of mold in their body and at home also. And then other things are such as infections and tick bites, like Lyme disease can cause joint pain and arthritis. And sometimes that can make it look like osteoarthritis when really underlying it is really an infection.
So is your suggestion then that people work with an integrative doctor because it's not really something they can figure out themselves? Is that sort of your feeling?
Yeah, well, integrative doctor, the art of integrative medicine varies from patient to patient. If a patient goes to a regular integrative doctor, it doesn't mean that they'll do what I do, because I've developed my own art over time. Because I've done the functional medicine training. I'm still going through very specialized training in mold and Lyme disease. So my knowledge is beyond just what I've learned as a foundation. So yeah, if you have osteoarthritis, it's worth exploring it with an integrative doctor. And sometimes maybe you do need that injection with the steroids or hydroxyapatite to Halgan injections to help with the pain levels and decrease the inflammation in the area.
Are there certain things that you found the most successful injections? I mean, do you have certain ones that you like?
Yeah. So steroid injections, that's usually the first go-to. The drawback of steroid injections is that on a microscopic level, it can minimize it can lose some cartilage microscopically. But if you have multiple steroid injections, you can actually see on x-rays that the cartilage is being lost. And after that, we usually do Halgan injections. It's a very viscous type of fluid. And after that, you can do PRP and other stem cell type injections out there to see if it helps with the jointing. But the problem is, if you have hand osteoarthritis, it's one of the most difficult osteoarthritis, because there's not much research being given. Usually when you hear about these injections, they're more in the knees.
Got it. Okay, so continue. So we work on root causes. You said, do you find that's common? Mold's common and all these things are quite common that you talked about?
I want to say common, but every patient is very unique, but I have seen mold at high mycotoxins in patients. So we look at those, and then I make sure the patient exercises as well. You have to do resistance training. You and I just had a conversation about strength training. That's really, really important to help with not only osteoporosis, but osteoarthritis as well. We know that with knee osteoarthritis, sometimes the pain gets exacerbated because their quadriceps are very weak. So we want to make sure we build the muscles on the lower extremities on top of the upper extremities. And then we also want to work on the stress levels, because stress can drive up inflammation as well. We know there's a neuroendocrine immunology system here that affects osteoarthritis. So a lot of factors that I look at for chronic illnesses, I also look at in my osteoarthritis patients. And I just have to see what turns up positive, what about their lifestyle is contributing to this inflammation. And we didn't even touch on food yet, but I have to make sure the patient is cutting out ultra processed foods and foods that are very inflammatory to the body, that an autoimmune patient wouldn't want to eat, an osteoarthritis patient wouldn't want to eat either.
Okay, before we get into the food, so what exactly do you tell your patients? Oh, doctor, I'm in pain. How do I gauge the pain with the exercise? Like, what's your advice to these people?
Yeah, I tell patients you got to exercise up to your tolerance. I usually like to write a physical therapy script to them and tell them to work with their physical therapist. And on top of that, there's no good medications for osteoarthritis right now. People take ibuprofen and Advil, those medications, but long term, they're not great, because you can get stomach ulcers, they can attack the kidney and liver. So I like to give supplements. I love to give osteoarthritis. Not osteoarthritis, but I love to give turmeric and curcumin. I love to give boswellia, and there's some other supplements like devil's claw, cat's claw as well.
Tell everybody your favorites, because this is something people can try, correct? There's not really a downside to this. So why don't you go into that in specifics, like what you would have, like what's the order that you would try these things in, I guess?
Right. So, I always recommend patients do work with a doctor when they do supplements. You got to get labs, because these supplements, yes, they're lower risk, but there is risk factors. They're not 100% safe. I've seen patients get high liver numbers, and it can cause liver toxicity just going on turmeric, because their genetics aren't processing these supplements like other people would. So my favorite is, of course, curcumin, which is the active ingredient in turmeric. And I like it around 2 grams. 2 grams is relatively low risk. I love boswellia. So that's my second go-to. Boswellia is also known as frankincense in essential oils. It comes from the Indian tree. And then there's also cat's claw or devil's claw. There's also Chinese skullcap. There's fish oil. There's vitamin D. So there's all these different supplements I like to give. Maybe not all at once. I do layer them in, because if you get a side effect, you won't know what supplements causing the side effect.
True. Okay, so you have people on the supplements that are very different than the medication that we know, yes, helps short term. And then what you said something just so important about the exercise, because a lot of people, I have pain, I'm going to calm down. But that you said the quads being strong. And I don't think people realize that getting yourself strong, even if you're in a little bit of pain, it's going to make such a difference, because it protects your joints. Is that what you've seen?
Right. Yeah. You want to get your lower extremities build muscle, and you want to get the quadriceps strong, because having a strong quadriceps will help alleviate some of the burden on the knee when you walk and do activities.
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout that contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important, because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com /osteoporosis exercises, or you can click the link in the show notes. Now back to the show. All right, so let's go to food. What are some guidelines for people? What are the foods that you found inflammatory and can actually exacerbate arthritis?
Yeah, so currently, the American College of Rheumatology do not have any guidelines on food and osteoarthritis. So this is something I've had to develop on my own over time. So the Mediterranean diet is a great start on what an anti-inflammatory diet can potentially look like. So a Mediterranean diet consists of whole foods, healthy grains. Also, it consists of fruits and vegetables, and some fish and animal products. Now, an anti-inflammatory diet can look there are variations of a Mediterranean diet that patients can eat. So some people, the Mediterranean diet, it allows gluten, but some patients, they flare out gluten. It causes inflammation. So that's one variation there. Other variations, some patients do flare on carbs or grains in general. So sometimes patients do have to take out some grains. I've had patients who flare on rice by itself. Also, some patients do have more pain on nightshades, which are your vegetables that consist of eggplants, tomatoes, bell peppers, and also lectins as well. Some patients do flare on lectins. So those are your beans and nuts. category. So there are so many variations of it, but I would say if someone's eating a regular standard American diet, the best place to start without overwhelming the patient is just to start a Mediterranean diet.
And do you have them keep a diary, a food journal? What do you have them keep so they can sort of maybe see what might be their kryptonite foods or what might be the foods that, really exacerbate their problems?
Right. So I do tell patients to keep a food diary because there's no perfect food sensitivity test out there. The food sensitivity tests are not 100% accurate. So sometimes when the gut is very dysbiosed, you'll see that almost all the foods on the list have some problem with the patient, which is totally not true. A patient will not have problems with all the fruits and vegetables out there. So I think a food diary is the best way of keeping a track record of what could be potentially causing the patient's flares.
Okay. But I love the fact that you see this correlation that people actually, even people who have, that's the other thing. People will go to the doctor and the doctor's like, bone on bone. That's it. Too bad. What do you say to that? Sometimes they do need surgery and other things, but what's your feeling when someone totally on x-ray says, I'm sorry, it's just the way it is?
Right. Well, I tell the patient, if we lower the inflammation, sometimes you don't have to have pain potentially. There are case studies out there with diets improving knee osteoarthritis. There's a couple of case studies on the scientific journal showing that a plant-based diet can help patients with knee pain. And there are also long-term studies out there that have shown that the more fiber patients ate, the less inflammation they had, the less obesity the patient had, and the less risk of a metabolic syndrome, which is high cholesterol, hypertension, diabetes the patient had. So there are a lot of things you can do with food before you throw in the towel saying that, hey, I quit, I'm going to get surgery. There's a lot of things we can do still.
I love that. I really like all the things that you're saying because how great, when you can do some of these other things that aren't really talked about. I think that's and that's why I'm so happy to have you here because just to let people know, wait, there are options. I mean, recently I met a young person who was getting something for me at a store and she was just like, oh, my hands, and she's in her 40s. Oh, we have arthritis in the family, and I'm like, that's not really normal. You should really see a doctor and just see what might be the cause of that, because it's too many people. But that's, the fact that you can change your diet, improve your diet, and then start seeing. And I see this all the time with people who do make changes and they're like, they weren't trying to do it because of arthritis, but they're like, oh, by the way, my joints don't hurt anymore.
Yeah. Food is so powerful. All the ancient cultures, ancient medicine, they always use food as medicine, but somehow, somewhere, Western medicine did deviate from that. So hopefully it becomes forefront of medicine in the future.
Oh, absolutely. Now, you mentioned sort of something that's near and dear to my heart is because I do teach a happiness program, but about stress reduction. And I think people minimize that. People think, they're so nervous about are they eating the right things? Are they doing the right exercises? And they don't realize the power that the negative, what happens with stress on the body. But what have you seen with the joints and stress, in your practice?
Yeah, stress plays a huge role in flares and pain. Stress will take a toll on inflammation. Stress will drive inflammation. Your brain is just not working in isolation. Your brain talks to the immune system. Like I mentioned earlier, there's psychoneuroimmunology. I already mentioned the endocrine immune system, but there's also psychoneuroimmunology where the brain talks to the nervous system, which then talks to the immune system, and they all sync up, and it will also affect the gut microbiome as well. So if there's immune cells in our brain, the brain is an active immune part of active part of your immune system. So when there's inflammation with stress, with anxiety or depression, that will translate into the rest of the body. So we have to keep stress in check. Now, we live in a modern society. Most of us don't live on a farm by ourselves, eating organic food without any other worries in life. So for most of us, we are dealing with some type of stressor every day, whether it's work stress, financial stress, or stress with our kids and family. So there is some stress out there, and every patient will have some degree of intensity of stress. So it's really important that we're not going to get rid of our stress, but we have to learn how to cope with our stress and how to view our stress in a more positive light. Only then can we shift the way our immune system perceives stress as well. As long as we're having a negative perception of stress, it will continue driving pain and inflammation. So, and the stress levels will affect the gut microbiome as well. So it will keep driving the gut dysbiosis also. So how do we relieve stress? We can relieve stress by, you can see a psychologist, you can work on your hobbies. I know there's a lot of things that a lot of people are working through. So getting a professional help is really, really important. Getting in touch with your religion again, just having fun in life outside of work. And yeah, there's so many things you can do to work on stress. And the exercise is one way to relieve stress as well.
Yeah, I love that. I think just the important thing for people to know is you have to prioritize this. You can't just say, oh, yeah, I'm a real stressed out person. No, you have to, and you're not going to change the world stressful. So you have to learn practices yourself. I mean, I do them. My mother, who was the most amazing person, died quite young. And, she was type A, amazing. But so it's not in my genetics, but I do practices every day because I know how critical that is. All right. So I'm just so glad that you shared how important that is. And that's what you see with all the patients that you work with. All right. So just one other thing I think is really important. Person gets a major flare up, something happens and they're in excruciating pain. What are some of the steps? Like, what can you tell them that might be helpful that they can do in this situation?
Yeah, besides medications, I'm assuming. So, if we talk about medications, steroids are the fastest quick fix. But not everyone wants to take steroids because you're an expert in osteoporosis and you know that steroids will worsen osteoporosis. So there are ways to minimize flares, and that starts to food as medicine. Sometimes not eating food at all can help with flares quickly. So if I do get a flare, I fast myself. I do a water fast. And when you fast, it will decrease the amount of inflammation in the body because it decreases a protein called mTOR. And when you decrease mTOR in the body, it will decrease the amount of inflammatory signals throughout the body. And so that's one aspect. But if a patient does have to eat, then I tell patients do green smoothies, work on your vegetables and fruits. Just focus on that. Don't eat any other food while you're flaring. That's one way. And also taking your supplements as well. All the supplements I mentioned, I take those myself if I do flare. And that combination, that concoction usually gets me out of flare pretty quickly. But every patient's, of course, different. Some patients, their flare is so strong and the disease is so advanced that doing some of these modalities I just mentioned doesn't fix the flare.
Okay. Anything with ice, heat, or red light therapy, anything like that you ever use?
Yeah, I love red light therapy. It's also known as photobiomodulation. So there are many great brands on the market, and patients can just buy one for their home and they can shine it on their joint. The studies have shown that it's anti-inflammatory. Icing and heat, it varies from patient to patient. But for example, myself, if I flare, I generally like ice more. It calms down the inflammation, and so do my patients as well. But some patients like the heat also. But when you're flaring, your joints are already hot already. Sometimes you want that cold ice to calm down that inflammation.
Oh, great. All right. So now tell us about your practice. Can people see you virtually, or how do you work?
Yeah, so I see patients all through the US and the world. I do have 15 state licenses. If you want to find me on my clinic website, it's drlifestyle.org. That's drlifestyle.org. I see patients virtually and in person. My in-person clinic is in Newport Beach, California. So I have patients drive and fly from all over the place seeing me. And on social media, I'm also known as My Autoimmune MD. That's MY Autoimmune MD. So I'm on YouTube, TikTok. I teach about chronic inflammation and all aspects of integrative and functional medicine on there.
Yeah, you have a really fun both your YouTube, your all your social media is really wonderful. And I think it's just so good that you're out there sharing this information so that people know there are possibilities. And, unfortunately, pain can just really zap your fun and really have a negative impact on your life. And it doesn't have to, right?
Right, right, right. Yeah. Pain sucks. Well, it sucks for everyone, but how you approach the pain can really brighten your day. And the goal for everyone is to be flare free.
Oh, I love that. So what are your last words? Anything I missed that you really want to share with everybody, or you want to just, what else would you like to say to people?
Yeah, if you're not happy with your doctor, there's always a doctor for you out there. You're not married to your doctor. You can always switch, and there's every doctor out there has the different training. For example, my training is very different from other rheumatologists, and the way I approach things sometimes gets patients the answers they've been looking for the past decade, and I get them pain free within like 90 days. But everyone's formula is different.
That's so important. And I'm such a big believer in digging deep, not stopping. Like if this person didn't help you, okay, well, keep going because as you said, maybe they didn't look at moles, or maybe they didn't look at
Definitely.
heavy metals, or maybe they didn't look at, Lyme, whatever it is, keep going you know, because as then you said, do you see people who've seen a zillion doctors and, they've
Oh
lived
yeah.
years?
Definitely, that's my population. They've gone to doctor to doctor because no one's asking the right questions. The doctors don't look at alternative medicine, and I ask those. That's my main focus, and I get the answers I want.
Oh, I love that. Well, thank you. I can't thank you enough for joining me. And I just think this message is so important that if you do have joint pain, arthritis, or inflammation, there's help, and they can go to your website and go to all your social media. And I think that's amazing that you have licenses to work with people all over. That's really,
Yes,
wow, that's wonderful because a lot of the people, and you even work with people outside of the country. Is that what you said?
correct. Yes, I do get consultations from outside the country. Of course, I can't give medications, but I can give advice.
Oh, that's great. Yeah, because there's people I love that. I love the international community that listens to the podcast. So that's so great. So always good to see you. Thank you so much for sharing all this wonderful information and for the work you do and just making such a difference in the world. So thanks so much for being here today.
Thank you so much for having me on the show.
I hope you enjoyed my interview with Dr. Yu as much as I did and learned something about arthritis, that there's so much that can be done. All the links that Dr. Yu talked about and ways to contact him will be in the show notes. So thanks so much for tuning in, and I look forward to seeing you on the next episode.